most times when giving care and treatment to children, we have to take into account their age, their weight. For children that come in with infectious disease, you have an infectious specialist that will see them. Children that come in with sickle cell disease, they have hematologists that will see them. Having a pediatrician treat children for various ailments is the best thing that could happen to children, because the pediatrician is well trained to handle issues like that. Now, there are various kinds of crises in sickle cell disease. Whether it's the anemic crisis when they are very pale and they need blood, or it's the vaso-occlusive crisis when they are in pains and they will need analgesia to help relieve the pain, and also IV fluids to help relieve the pain. It could also be a sequestration crisis. Sometimes it may even result into surgery if they need it. It depends on, most times we try to look out for the cause of the crisis. So, for example, a child is having a vaso-occlusive crisis, pains with hands and feet. There are management principles that you need to follow. Okay, the child is in pain. The first thing to do is to relieve the pain. What do you do to relieve that pain? Physically, the child is in pain. You might need to give analgesics, give IV fluids, in trying to relieve the pain. And then you look out for the cause of the crisis. So if it is that the child has an infection, that means you have to treat the infection. If it is that the child is dehydrated, the child is not taking adequate fluid, that's why the child is in crisis, then you need to give the child fluids. So it depends. Or if the child is psychologically down and is an emotional stress, or even a physical stress that is leading to the crisis, then you will have to treat the cause. So you will still have to look out for the cause and treat it, the underlying cause. If not, the child will still keep coming down with the crisis. So you don't just treat symptoms. You don't just treat like a tree now, when it's cut down. If you don't cut down the root, it will still grow back. And so you don't just look at the roots, the branches. You go down to the root of the problem and treat it. So anytime a child has crisis, you have to look for the root of the problem and treat it, apart from treating the symptoms or the crisis that the child came in with. It has to do with communication. So the rest of the kids will have to understand that this child has sickle cell anemia, and because of that peculiar problem that the child has, he will need, let's say, more care. So frequently he might have to be taken to the hospital for routine checkups and drugs that the child will have to take daily. And then you will have to explain to the other kids, for example, if a child with sickle cell anemia, we know that one of the precipitating factors is stress. So if the child is not being, if you don't avoid stress for the child, it might lead to crisis. So if you explain to the other kids, for example, they will all need to, you distributed chores for them. And some will have to sweep, some will have to clean and all that, just to make them understand that it's not as if you love them less than this. You might still give the child maybe to clean the table, something lighter for him to do. And then as much as possible, try to always explain to the others that it's just because of the condition that the child finds himself in, they will need to be more careful when dealing with the child. Not just only you, try to inculcate them when it comes to the care for that child. Maybe helping the child remember that he has to take his drugs daily and all that. Okay, if he's getting stressed, they should be the ones to even tell him, oh, you need to rest. Oh, you've forgotten, you've not taken enough water today. Take this, do that. And so if you communicate with them and you make it a family affair, then they will get to understand that, okay, it's not as if you love this child more than the other. It's because of the peculiar situation. And I tell you, when they see him in crisis, nobody sees a sickle cell child in crisis and not feel bad. Anytime they see him, especially in vaso-occlusive crisis, screaming for pain and all that, I'm sure they will understand that, okay, we don't want our brother to go through this. So let's put heads together to help alleviate this. It's just a lot of communication and guidance. With that, you'll be able to know the dividing line and not show, so that the other kids will not feel, okay, yeah, favoring this child more than the others. When it comes to feeding, it's not peculiar to feeding children. It's not peculiar to sickle cell anemia patients. I've had a niece that is not a sickle cell anemia patient, but she also will not eat. So when it comes to children, you will have to put a lot of effort to feed them, and they are all not the same. Some kids will, before you say Jack Robinson, they will be the one asking you for food. They want this, but others are a bit picky. So when you have a child that's a bit picky, that will not always want to eat, you will have to be patient with the child. One, let's make eating time not to be forceful. The mother will have to take it upon herself not to be anxious and forcing the child. Okay, you must eat this. This is what I have. You must eat this. Let it be a playful time. Let it be a joyful time, and let it not be in a hurry. And so she can even include the child in the preparation for the food. Okay, there, what is it that you think you want to eat today? Okay, today I'm going to make rice, and then okay, we're going to add some things that look like the faces of bunnies in it. So talking about the carrots and all that, she can even decorate it, and let it be a fun time for the child. And when it's time to eat, you don't force whether the child will take 2-3 spoons, take time to play, and then come back again and eat. You will need to be patient, and then you will need to try a lot of different kind of foods before you know what a child will really be comfortable with, will like to eat. So some kids will not want to eat a lot of foods like tuwo and the rest, and they will prefer things like rice. So if you can get another alternative that will provide the same ingredients nutrients that the child needs, that will have carbohydrates, fats, and protein, the major classes of food, then you will always go around and look for those things and mix it and let the child take. So it's a lot of stress, but with if you make it it's your job, and you don't make it sound as if it's a burden, and you don't give up, with time, just little by little, you can always encourage children to eat. But let's not make it forceful. Let's not make it let's not be in a hurry, and let's not give up. They definitely at one time or the other will overcome it and start eating. Salmonella is an organism, a grammatic organism that causes that can cause typhoid fever, and so it's common in tropical countries because it has to do with our hygiene. It has to do, it's a what most times you get it through food and water. If your hygiene is not good, and then the kind of foods you eat and water, if they are contaminated, that's how you get salmonella. So it's common, but for other children, because they have good immunity, they are able to curb the disease. Most times it doesn't become a septicemic illness. Maybe it just gives them some gastroenteritis, some vomiting and diarrhea, and they are okay. 1, 2, 3 days, they can curb the illness. But for children with sickle cell anemia, because of their defective immunity, they succumb to infection with salmonella a lot. And so best way to prevent it is to improve our hygiene. People go buy things on the streets, food vendors, their foods are not closed, you don't know the kind of water they use in making the food, and even while dishing out the food, the plates, the spoons, the fork, not properly clean. So as much as possible, a child with sickle cell anemia should not be eating outside. That means the mother should take care and prepare the food under good hygienic conditions. And also water. It's one of the easiest way of getting the infection when you take contaminated water. So let's ensure that we don't take all this pure water that they buy. Sometimes the conditions where these pure waters are being made is not the best. They are not made in very hygienic conditions. So I prefer that even if it is tap water you have, boil it and then store it so that the child will take from it, instead of buying all this pure water that we are not sure of. And also, when it comes to our toilets where we defecate, most times we defecate on the road, the street, not having a good toilet facilities. And so when the rains come, they just take all these things and dump them on our rivers and even the wells. So we must ensure that we have good toilet facilities, good dumping sites, so that all these things will not find their way back to our water and contaminate them. So those are the ways to help prevent that, because especially for sickle cell patients, they succumb to that because their immunity is not good enough to be able to handle that infection. Once a mother is AS and the father also is AS, for each pregnancy there is a 25% chance of having a child that is sickle cell anemia. It's called chance. It's a chance. So you cannot decide that the firstborn will be sickle cell, the second, they will skip the second, and then the third child might be sickle cell, and then the fourth. It's a chance for each of the pregnancy. You don't know what the outcome will be. I've seen parents with 4 kids and all of them are sickle cell anemia patients because they are both AS. So that means the 25 chance happened for each of those pregnancies. And I've seen parents with 3 kids and none is sickle cell anemia. All of them were carriers. That means the 25 chance didn't happen for each of, so it's per chance for each of the pregnancy. Now I have seen some that just like that, it will skip. The first child is sickle cell, second is skipped, the third is skipped, the fourth is sickle cell. So it's just for each of the pregnancy. And you don't know which one is going to take that 25% chance. So it's by chance, it's chance. The things that trigger sickle cell, as I said earlier, their crisis are any emotional stress, physical stress, apart from the infections, that whether it is malaria or it's a bacterial infection, too much heat, too much cold, when they don't have enough oxygen, tension and all that. So making the child trek is a form of stress, especially if it's for a long period. It's a form of stress, and that will rather trigger the crisis instead of preventing it. And so what he should do to prevent it is to avoid much stress for the child, and then let the child take a lot of water and then take her routine drugs and avoid things that can cause infection like malaria and other bacterial infection. Let her not be exposed to too much cold or heat. So those are the things he should do to avoid the crisis, not the other way around. He shouldn't put her through stress that will make the bone strong. It's not the fault of the bone. It's not the bone that is causing the crisis. It is that the cells that are being produced are sickled, and so they get blocked when they pass through the vessels. That's what causes the pain. So it has nothing to do with the bone per se. So making her bone strong and making her to walk is not going to help avoid the crisis. There is no age limit. There is no age limit. God is the giver of life. He is the one that made us. He knows. Apart from that, if a sickle cell child is given all the care that he needs, then the child can become, when it comes to, just like I said, being a doctor, you can train that child to become anything, any profession the child wants to be, and then the child can live as long as God has allocated for that person on it. So it should not be that it's only sickle cell disease that is cutting short the life of the child. So the child can stay. It's not a death sentence that because you're a sickle cell, then that means you cannot live beyond 18 years. Well, I have a lot of friends, patients I've seen that are married and they are sickle cell patients. They've gone above the age of 40 even. And we know of a sickle cell anemia patient that reached the age of 70. We have lots of youths that are, when you talk about deaths in developing countries, okay, they've pegged that most times by age 50, 55, that's when that's our own mortality rate for us here. But it's general. It's not that it's for sickle cell patients. So let's not tag them and say, okay, because you're a sickle cell patient, then you cannot live above this age. They can't survive. Sickle cell is not an infectious disease. It cannot be transmitted via talking, playing, or breathing the same air that the child has. No. Sickle cell is a blood disease, is a genetic disease. You inherit it, you are born with it. So there is no way playing with a child or taking care of a child that has sickle cell anemia that it can be transmitted to the next person. It's just a myth. That is not true. You cannot get sickle cell anemia by playing or taking care of a child with sickle cell anemia. It's a blood disease. I am Dr. Mariam Shehu. I'm a consultant pediatrician with Bingham University Teaching Hospital, Jos. And my advice to parents on how to take care of kids with sickle cell anemia is first for them to understand that a child with sickle cell anemia needs a lot of care. And when the child falls into crisis or the child is in pain, it's not the fault of the child. Neither is it also their fault that the child has sickle cell anemia. So once that is cleared out, the next thing to do is to try as much as possible to provide for the child. The first thing is to ensure that the child is taking his routine drugs, folic acid and paludrin. And they should also make sure that they visit the clinic. We have centers, we have hospitals that have sickle cell clinics. So there is one in my hospital, I'm sure there's one in Jude and some other hospitals around. They should ensure that they carry the child routinely for checkups. And then also try as much as possible to avoid triggers. So things like in trying to avoid triggers, they should try as much as possible to prevent the child from having malaria. That means their windows, their net, their doors should be screened. The child should sleep under insecticide-treated nets. The child should always be reminded to take his or her routine drugs and also be given water constantly. They should always be hydrated because we know that dehydration is one of the reasons why they can go into crisis. And then ensure that they eat balanced diet because their immunity is not too good. They need to grow healthy, they need to be strong, so they should be given good balanced diet. And ensure that the environment is friendly and good for them. Don't blame them, don't make them moody, because whether it is emotional stress or it is physical stress, all this can lead to crisis. It's not a death sentence as long as we do our best and try to make sure they have all these things. We've seen sickle cell patients that are doctors. I have colleagues that are sickle cell and they are doctors, and they have given birth, and some have even stayed up to 70. And so it's not a death sentence as long as they learn how to manage it and believe God that all can be well, and I'm sure they will get through it.